which then processes the data and allows it to be viewed by centralized staff or researchers via laptop PC and the web dashboard. The H stands for health. eMocha was developed within the Center for Clinical Global Health Education at Johns Hopkins. And our mission is to target challenging health issues and questions with a particular emphasis on education, training, patient care, and evaluation. So we wanted to build a mHealth platform which would leverage our existing expertise and skills. And finally, this is an application based on the Android operating system, which we felt in low and middle income countries had the greatest potential for scalability. So let me shift now to some concrete examples of projects both in development and also being actively implemented. Here's an example. It's called eMocha M Peer-to-Peer, which involves real-time assessments and peer-led interventions for Baltimore injection drug users. So the idea behind this study and development is that you actually give phones with the application to active drug users, and then you ask them to enter in real-time behaviors and also potentially track their locations. And based upon this real-time assessment of behavior and location, you can target interventions. Here's a picture of our web dashboard showing some of that location tracking. And we're hoping to evaluate this in a randomized trial fashion. Another type of bread and butter study is eMocha Afghanistan, where we're doing HIV surveillance of female sex workers in Kabul. And this study is actually being implemented later this month and has been an interesting experience trying to work with different languages on the Android platform. Here's another side of the academic perspective on mHealth. This is a project in development called the HOME study, which stands for HIV/AIDS care optimized through mobile empowerment. And the objective of this study is to determine the effect of using eMocha by community health workers on patients' HIV medication adherence and retention. And this may not be that pleasant to look like, but I just wanted to give you an example of some of the thought processes that we go through in trying to think about what are the actual processes, behaviors that we can measure, that we can study, that we can impact. And this is one of the things that we, I think, bring from our academic background. So here's a model of our conceptual framework. So how this eventually gets applied into the field may be as follows. For instance, in step one, the community health worker would interact with the patient, assessing their adherence to medications using a visual analog scale. In the second step, they would run through a checklist of common barriers to non-adherence. And then based upon this information collected, there would be an automatic referral to certain services, or the community health worker would be informed to counsel the patient on specific tasks. But you shouldn't just take my word for it. Henry's now going to talk about a specific application of eMocha called Prevention RX. I'm going to put up my acknowledgement slide. Thank you for everyone, and allow Henry to finish the talk.